Good day everyone. Today we will be discussing about the drug named Sacubitril-Valsartan. It comes under the pharmacological category called angiotensin receptor neprilysin inhibitor. Sacubitril-Valsartan is a combination product. Sacubitril is a prodrug that, upon activation, acts as a neprilysin inhibitor. The drug works by blocking the action of neprilysin, preventing the breakdown of natriuretic peptides, which leads to a prolonged duration of the favorable effects of these peptides. Valsartan is an ARB that works by blocking the RAS system. However, because neprilysin breaks down angiotensin II, inhibiting neprilysin will accumulate angiotensin II. For this reason, a neprilysin inhibitor cannot be used alone, it should be combined with an ARB to block the effect of the excess angiotensin II. Another substance broken down by neprilysin is bradykinin. Neprilysin inhibition will also cause a buildup of bradykinin. Therefore, sacubitril cannot be used with an ACE inhibitor due to an increased risk of angioedema if ACE inhibitor and angiotensin receptor neprilysin inhibitor are used together or dosed in a short time frame. When switching between ACE inhibitor and sacubitril-valsartan, the patient must undergo a 36-hour washout to lower the angioedema risk. The medication is FDA approved to treat patients with chronic heart failure with reduced ejection fraction in NYHA class 2, 3, or 4. Sacubitril-valsartan is used instead of an ACEI or ARB and in conjunction with other standard heart failure treatments. It is also FDA approved for pediatric patients with heart failure. Adverse effects include hypotension, hyperkalemia, renal failure, cough, and angioedema. In a trial comparing sacubitril-valsartan to enalapril 10 mg twice daily, sacubitril-valsartan was associated with a higher incidence of hypotension and symptomatic hypotension. Sacubitril-valsartan was associated with a lower risk of elevated serum potassium or serum creatinine and a lower risk of cough than enalapril. Sacubitril-valsartan is contraindicated in patients with hypersensitivity to any component of the product. A prior history of angioedema due to an ACE inhibitor or ARB. In diabetic patients receiving the renin inhibitor, aliskiren, specifically, the valsartan, any ARB, is contraindicated with aliskiren due to an increased risk of hypotension, hyperkalemia, and renal impairment. Patients who have received ACE inhibitor within 36 hours due to increased risk of angioedema. Severe hepatic impairment. Monitor for improvement in the clinical signs and symptoms of heart failure. Monitor volume status, weight, chemotherapy drugs, sodium intake, and the ability to perform activities of daily living. Transthoracic echocardiogram assesses ejection fraction and potentially identifies the etiology of heart failure. Because sacubitril-valsartan therapy affects several biomarkers and specifically inhibits the breakdown of brain natriuretic peptides, BNP is elevated in patients taking this drug. But BNP is not a reliable marker of heart failure exacerbations in these patients. Regarding safety, renal function, and serum potassium should be monitored, especially at the initiation of therapy and in patients with risk factors predisposing them to renal impairment and hyperkalemia. Thank you. Kindly comment for further queries and doubts.